Okay, well, I'd like to get started. Gina Lisa, you ready?
Ready?
Okay, awesome. Well, first off, my name is Jason Torres. I'm the chair, and I'd like to welcome you all to a webinar on caring for the elderly. The unfortunate part of life that we all have to deal with is that we need to experience dealing with a loved one or elderly passing away. And so each one of our parents are going to pass away, our grandparents, our loved ones, our aunts and uncles. And so whether they age with dignity is really up to us. And so what we've done today is we brought in a subject matter expert, Gina Lisa. She runs an organization called Connect Care. And Connect Care allows our parents and loved ones to age with dignity and receive the care that they need and deserve. And so her website is connectcareag.org, connectcareag.org. And she's offered to be helpful with individuals that are dealing or with a loved one who's aging and needs some assistance to give a consultation. Just let them know. You're a member, brother, and and she'll be helpful in giving a consultation. But we have a number of questions which we'll get into, and but with that, I'd like to turn it over to Gina to introduce yourself and your company.
Thank you. Good evening, everyone. My name is Gina Lisa Monteroso, and I am the CEO and founder of Connect Care Advisory Group. And what is Connect Care Advisory Group? We are an agency that we assist the elderly and disabled to become eligible for a specific Medicaid program that allows people to qualify with high income and high resources so that Medicaid can pay for home care up to 24 hours a day, 7 days a week, assisted living, and nursing home. And we're going to touch base today on those three different components. So what I want to do first is kind of talk about the topic of caring for a disabled and aging parent. What is that, and how do we assume this responsibility? It's a responsibility that we will all end up having to assume, and we are not prepared for it. No one taught us to take care of an elderly loved one. No one guided us. There are no education courses that can let us master this. Just one day, someone becomes sick, someone becomes very frail, and they're not able to manage at home. And we become that responsible person. And what everyone fails to realize is that when you assume that responsibility, you are a caregiver. And that's when the bumpy, crazy ride happens. And what do I mean by that? We have to worry about someone eating. We have to worry about someone's managing their finances. We have to make sure they're taking the medication. And on top of all of that, we have to manage our own day-to-day. We have our own life, our own work, our own responsibility. What's out there that's able to relieve us of this and get us up and running and help us make sure that our loved one is being cared for appropriately? And what we're going to talk about is the word Medicaid. And when we think or we say the word Medicaid, the first thing that runs into our mind is someone who's very poor, someone who has no money, and why would we want to apply for Medicaid? And I remember when I first got into this industry, very young, early 20s, my dad used to talk about Medicaid, and, he used to be like, you have to hide your money. You can't have a bank account, close everything. You are not allowed to own any assets, and you need a handout. And that's what we were kind of taught that Medicaid was about. And when I entered this healthcare system, I found that we were all wrong, and we were taught the wrong things on how to view and understand what Medicaid is. And Medicaid is a federally funded program that New York State has opted into that would give us help for our disabled and elderly loved ones. And there's a program specifically for our elderly and disabled. It's not a program where I can apply for or anyone who's able-bodied. And this program allows our elderly and disabled loved ones to preserve all of their income and assets so that they are able to get 24-hour home care. So they are able to get an additional insurance besides the Medicare insurance that they're getting to help them assist them with additional medical costs, transportation, food, case management, nursing care. It's a health insurance that will guide and assist elderly and loved ones, and it's for our long-term care. And so we're just going to go a little bit about the basics on the whole financial component. So our first thing that we worry about is my elderly or disabled loved one is home. No one's caring for them. I'm running back and forth. I'm trying to make sure that they need care. What do I do? You can apply for Medicaid, and you will apply for the disabled and aged Medicaid. And there are different income and resource levels that qualify someone for Medicaid. Now, we all know there are certain dollar limits and certain income limits. So let's just talk a little bit about that. In order to qualify for this specific program, a single person can have up to roughly $15,500 in a bank account. No one ever knew that. Our elderly loved ones are hiding their money in a shoebox, and they're like, I have no money. You can have up to $15,000 in a bank account. And if they're married, a married couple, they can actually have up to $120,000 in a bank account. Wow, we didn't even know that, right? Because our family members telling us we need to hide our money. They're changing names into bank accounts, but this is catered for long-term help. And another misconception that we have about this program, or Medicaid, I can say, is that they tell me, Gina Lisa, I don't qualify for Medicaid because I own a home. Well, with this program, your home does not count as an asset. If you are living in the home and you require home care. So how can we apply for home care and help, and then Medicaid is going to take our home? Doesn't exist. You're allowed to have a home and live in the home and qualify to get up to 24-hour home care. Another misconception is retirement accounts. Many people tell me, oh, Gina Lisa, I don't qualify. I have too many retirement accounts. I have IRAs, I have a 401k, I have some Roths running around there. I don't qualify. What this specific program does is it allows our clients to keep these retirement accounts and they become exempt. So if you have $2 million, $3 million in these retirement accounts, they are actually exempt. You can qualify for Medicaid and still keep this cash in these retirement accounts. The only thing that they would let you, that would not be exempt, would be the yearly return that you get out of this, out of these retirement accounts, and they would just consider them income. So those are a couple of things. We have the home, we have bank accounts, we have $15,000 for a single person, $120,000 for a married couple, retirement accounts. You can own a car, you can own one car, you can own jewelry. There are many things that this program allows you to have. And even if you exceed what they allow you to have, there's different ways that you can actually plan on how to preserve and still qualify. Because remember, this program is only for someone who is disabled or over the age of 65 and over, and they are living on a fixed income. Different states have different rules. New York City is a lot more friendlier when it comes to the rules, and it allows our elderly and disabled population to preserve a lot more than other states. But we want to make sure that we look for this help, because this specific program will relieve everything that you are dealing with on a day-to-day. It's going to give you less stress. How? Because this program, because it's a health insurance, it also comes with a case manager, someone who's going to manage the case, make sure that the Medicaid recipient has everything that they need: diapers, chucks, supplies, transportation. The state has actually contracted with different car service companies that actually pick up the clients and take them to their doctor's appointments. There's food delivery programs. It's not Meals on Wheels. They're catered, good, fresh food that's actually delivered to our elderly and disabled population. There's rehab. There's home care. There's additional doctor services. There's so much. And what we would like to do, and what I'm here to do, is kind of make sure that we are very comfortable and say, I need help and I cannot do this alone. And is there something out there that can help? And this program is help. And it's a program that nobody talks about. No one knows it actually even exists. And this is why we are here to discuss the benefits and how we're able to assist our elderly and disabled loved one. It's about taking the step and going on to the right road, to the right people who are going to help you. When we get in trouble, we run to our attorney. If we get into some financial situations, we're running to our accountant. Here, our agency, we're a care management company, and we specialize in navigating and making sure that our elderly and disabled loved ones get everything that they need and still able to maintain their home, maintain their bank account, maintain their income. So rest assured that there are services out there to assist you.
This is great. No, that was a great, I appreciate that. That was thorough.
You're welcome.
So do you mind if we just jump into some questions?
No, not at all.
Yeah. Okay. So some of these questions are very specific and we can dive into that. And then some of the questions are a bit broad. And so let's jump into the first question. So my father is 90. My mother is 86. They are independent. However, transportation to medical appointments is a concern since my brothers and I, as most people, have to work.
Yes.
So what advice can you give?
So again, we go back to this amazing, generous Medicaid program. It provides transportation. It's an actual private car service that will pick them up and take them to their medical appointments. If they are in wheelchairs, there's an ambulette that will pick them up and take them to their doctor's appointment. It goes back to this program that has been developed and put in place to assist, to make sure that this independent couple is able to get to their medical appointments and they do not have to rely on family. So I would definitely explore Medicaid to make sure that this service and this insurance is in place so that the transportation is covered. And all they do is just pick up a phone, call the car service, and the car service is there and will pick them up to and from round trip to their appointment.
Okay. How to deal with a loved one's estate after they both pass?
It's difficult. It's not an easy task. What the best advice that I can give is, if you are not aware of all the finances that are in place, try to see if you can find an old tax return an old tax return will truly get you to a point where you need to start. And if there's no will, obviously you need an estate attorney to kind of help you with someone becoming the administrator of the estate, and kind of just seeking out as much financial information that you possibly can, because that all has to be reported to the court and everything needs to be distributed accordingly, and it go by siblings, spouses, and wills.
Right. Having some questions come in live, so this is interesting. So Arturo Gonzalez, can a family member be eligible to become a case manager?
Okay, so there's two different things. Hi, Arturo, how are you? So Medicaid has this amazing program. I know I keep saying that word amazing because it really is, where they would provide 24 hours of home care 7 days a week. And if you do not want a home care agency to be part of this care, you can actually hire someone yourself that you trust. They do not have to be licensed, and Medicaid will pay them directly. And Medicaid in New York City, each county has their own rates. In New York City, Medicaid will pay up to $19 an hour. They have programs that give you health insurance. There's time and a half. There's sick time. There's vacation time. So you yourself or a loved one can actually become a caregiver and register to become to get paid directly from Medicaid. That wouldn't be considered a case manager. You would be more part of taking on the responsibility of the care, but you would be getting paid for it, if that helps.
Okay. So how does the state determine eligibility for a home attendant?
There is no eligibility. If you trust them, you know them, we send them over to a registered agency, and this agency is contracted to do kind of a human resource intake. They make sure that your medical is up to date. Mm-hmm. You have to take a drug test. It's a 10-panel drug test. They do a background check, and that's pretty much it. And you also have to be legal and a citizen in order to qualify for the program. So we have legal or a citizen, a drug test, and a background check. Mm-hmm. And that's it. And you're able to get paid to take care of your loved one. It's a great program.
Yeah. How do we best determine when it's time to move a parent into a long-term care facility? My father-in-law has a neurological degenerative disease and can no longer move around independently. The physical and emotional stress is beginning to wear down my mother-in-law, but they're both stubborn, reluctant about non-home-based solutions.
Yeah, so that's a good question. And so let's kind of talk about a nursing home. The first thing that comes to our mind when our elderly family member is not able to function at home is put them in a nursing home. Now let's kind of define what a nursing home is. A nursing home is not a medical facility. A lot of people think that a nursing home is a medical facility. It's just a home, just as if they were home. If something was to happen to them, they have to call 911. They are not allowed to do any medical treatment on site. So what we do is this amazing program that I keep talking about, we are able to bring the nursing home to their home, because what we don't want to do is be that person to boss our parents or loved one around and say, hey, you got to go. That's not the approach that should be done, because you will become the bad guy. They're going to be resistant to anything that you want to say or try to help. You know why? Because you want to tell them where to live. And Medicaid created this program where instead of having to be admitted into a nursing home, the program can come to your home. The only people that should be admitted into a nursing home is someone who's unaware of their surroundings and they are a harm to themselves or to others. If those are not the criteria that these recommendations are coming. There are many programs that are put in place to keep our clients to remain in a community-based home.
Got it. We're talking about Medicaid, and Medicaid is run at a state level. So how does this work if an individual is out of state? So here's the question. I'm out of state, and there are times that I call Uber to drive my parents to medical appointments. Are there programs to drive parents to their appointments?
Yes. Medicaid does have a transportation component. Again, you would have to apply for this specific Medicaid for the disabled and aged, and there is a transportation component where they would pick up the elderly or disabled person and bring them to their doctor's appointment and bring them back home. So that would fall under the Medicaid component.
Got it. Jumping back to finances and eligibility, if your parents are over the limit in terms of finances, do they have to give anything up, i.e., there's this term called spend down. So how do you apply for the benefits while taking into account these various caps and limitations?
Yeah, so spend down, yes. You hear this word spend down everywhere you go. So what we need to understand about Medicaid is there's many different programs under this umbrella. We kind of think that there's this one office with this one person, we apply and then we get Medicaid. There are many programs that fall under Medicaid, and everybody's Medicaid card is coded differently. And so for our elderly and disabled, we have community Medicaid, which allows you to transfer and gift and still qualify for Medicaid. And there's no look back period and there's no spend down. Then you have nursing home Medicaid, where you want to admit someone into a nursing home permanently, and that would be their long-term residency. And there is a spend down, but there are ways to preserve and make sure that you're able to keep as much money as you possibly can, but you would still have to spend down at least half. And then you have assisted living Medicaid. It's the same thing as community. You're allowed to transfer and preserve and still qualify for Medicaid. So everybody uses this word spend down, but it doesn't necessarily mean that you have to spend down. Just know that there are options, and always make sure that you go to a professional so that you're able to plan and preserve as much as you possibly can.
Got it. That's helpful. Is there a limit on the number of home attendant hours that a parent can receive? And how do they determine the hours allotted?
The hours are allotted. It's a medical criteria. It's based on what you can or cannot do at home. Can you make meals? Can you bathe? Can you dress yourself? Do you need assistance going to the doctor? Medicaid can approve up to 24 hours of home care a day, 7 days a week. There was a limit of aides, did you say?
How many home attendant hours can a parent receive, and how do they determine the allotment?
Okay, so yes, it's based on a medical need, and it can be up to 24 hours, 7 days a week.
Okay, so this is coming from Keith. My dad has been unable to work since having a massive heart attack, and my mom has recently qualified for long-term disability. I've been trying to keep up support while out of state, but I'm struggling to provide that support. Given that they've already started a lot of this, how best should I approach consolidating the information and coordinating their care?
Definitely make sure that you know where their bank accounts are, how much income they're getting. You definitely want to apply for Medicaid because, again, this is a situation where you're going to need extra help and they are going to require long-term care. And you want to apply for Medicaid so that they can get these extra services so that you don't have to be doing the extra work, and you get a case manager who's able to assist you and guide you to what services they would need to keep them safe at home.
Right. Are there any tools to help with that in terms of like remote patient monitoring? Any web tools to help coordinate these activities?
There are a lot of different tools that are put in place to assist our elderly. It all depends on our elderly or disabled loved ones. You know, we have the feisty ones who barely can hear and can barely get out of bed, but they don't want any help. They leave me alone. I got it. You know, the tele meds are good. You know, some of them really don't enjoy learning technology. You know, they're living sickly day to day. They don't want to learn, you know, another technology. But you want to make sure, so you have that feisty person who is not going to let you do anything. Look for some navigation tools where you're able to monitor where they are, what they're doing. We always recommend a camera. You know, we use a Nest Cam for a lot of our clients, where you're able to just put the Nest Cam and you're able to see them at home. And you can even talk to them through the mic through home, so that you're able to kind of monitor what they're doing. And, you know, those types of patients, you want to make sure that, you know, you approach them very lightly, and you have to wait until they get into a position where they really can help themselves before they ask and accept the help.
Great. So when we get these home care attendants, these what services does that include? Does it include everything from home chores? Is it just daily activities of daily living? What does the home care home health, what does that encompass?
So a home health attendant is able to wash clothes, cook, clean, take you to your appointments, and remind you of your medication, shower and bathe you, grocery shopping, appointments, medical appointments. They are your companions for the day.
And then what's the next level of, you know, type of therapy, OT, PT? How does that work with Medicaid?
That's different. That is not part of the home health aid benefit. Mm-hmm. That is under the Medicaid insurance component, and it's also under the Medicare component as well. So a lot of our disabled and elderly clients already have Medicare. And Medicaid would just be a secondary insurance that would supplement whatever Medicare no longer supplements. And just FYI, Medicare does have a home care component that would supply up to at least 4 hours a day of home care for 5 days a week for free. Please feel free to reach out to us to get some more information on that if you're interested.
Okay. Can these services, these Medicaid services, are they transferable to other states or to Puerto Rico?
No. So each state has opted into the Medicaid program differently. Of course, New York is a very giving state, and you know it's the melting pot. New York State will provide 24-hour care at home, whereas New Jersey will only provide 35 hours a week at home. So no, you cannot transfer your Medicaid, and each state does have different requirements in order for you to qualify. So if you leave New York, you would have to reapply to the next state that you move to.
And
Same thing with Puerto Rico.
And it's based on where the beneficiary lives. Is that right?
Yes.
Okay. I have some other questions here, and we still have some questions coming in on the Q&A, but in the interim, how do we think about the right managed long-term care agency? How do we think about support home care agencies, and then finding and paying for assisted living? So there's a couple of things there to unpack, so we could start with that.
So how to find the right MLTC managed long-term care program. Mm-hmm. So let's just talk about what MLTC means. Managed long-term care program. And what happened with Medicaid the government decided to make part of Medicaid private. So we actually have public and we have private. And anyone who's over the age of 65 or disabled would have to enroll into an HMO. And these are private companies who are now a Medicaid company. And how do we find the right company? There are not many MLTC insurance companies out there. But what you want to look at is someone who's just been around for a long time. I always kind of run over to Blue Cross and Blue Shield. It's a very established company. They've been around forever. Their service is great. They comply with everything that they're supposed to be doing and give to our elderly loved ones. There's also, if you go to www.medicare.gov, you can actually even see the star ratings of these MLTC programs. And, obviously you want to look for a 4 or 5-star rating. But ask questions, you want to make sure you're working with a company who's going to be there for you and answer all of your questions. If you're working with a company and you don't feel, I'm not, getting any service or they don't answer the phone, that's not the company you want to go with. You want to go with a company who's informative and is going to assist you. And always remember, all MLTC companies have to provide all the same things. So not one company is not providing more services than the other.
Got it. And then finding and paying for assisted living?
Medicaid actually will pay for assisted living. Medicaid has 2 Medicaid assisted livings in New York City. They're actually very nice. And Medicaid will cover the care in full at 100%. And there's also what's called independent living centers. They're a little pricey. They could start off anywhere from $2,500 upwards to $10,000. But Medicaid would cover the 24-hour home care that the elderly or disabled loved one would need in order to live in this assisted living.
Okay. How do we think about comorbidities when an aging parent or an elderly parent has, or a disabled parent or loved one has a number of comorbidities, including, obesity, mental health? How does that all work?
It's part of life. We end up, aging, and, there's things that we kind of take with us, from young or some tragedy or something, and things happen and we get all of these different types of diagnoses that need to be treated. But there's programs out there. Medicaid is I'm going to go back to the same program. This is the program that's going to make sure that the mental health component is being taken care of. If there's, issues with weight, between Medicaid and Medicare, they cover. There's nutritionists, there's dietitians. They even pay for, surgery. So we have to understand that there's insurance out there, and it could be public or private, that's going to assist us with all of these different ailments that we're dealing with on a day-to-day.
Okay. And going back to a previous question that we had around the hours of home care, can we elaborate more on the 4 hours of home health care from Medicare? Specifically, specifically if his parents live with him, do they still qualify?
Sure. So just remember, our parents are adults. Just because they gave birth to us doesn't necessarily mean that we are responsible for them. We are taught as children that we do need to take care of our parents, but we are not responsible. Just remember, because they live with you, they are still independent. So they would qualify for this Medicare 4-hour home care. But the only issue with this Medicare home care is that it's temporary. But if it's something that you just need as a Band-Aid and to use at the moment while you explore Medicaid, it's something that you should utilize. And it comes with rehab. If your elderly or disabled loved one needs physical therapy or occupational therapy or speech. That also is part of the Medicare program, but it's a little tricky to get it, but you are able to get it. And please feel free to just call our office and we can definitely guide you.
Okay, we'll come back to that in a second. Jumping back to New Jersey Medicaid, and just to confirm, they only offer 35 hours per week as far as coverage for is it caseworker or home attendant?
Home attendant.
Home attendant.
Someone to assist you at home. Someone to help you with the cooking, the cleaning, the bathing.
Right.
Home help. They only give you 35 hours. And they do have a component of an MLTC, but it's not really structured. It comes with a case manager, but the benefits in New Jersey are very small. They're not sufficient enough for our elderly and disabled to remain in the community, which is why a majority of them always end up in an assisted living or nursing home, unfortunately.
Yeah, yeah. And so New York has a very rich benefit for Medicaid, whereas other states don't have as rich a benefit.
Correct. Yes.
So if you're going to be elderly and we're going to need to take care of an elderly or loved one, you should be in a state like a New York where you can get these services and get the assistance from a Medicaid.
Correct. You want it when you retire or your parents retire, and these are talks that we should be having, with our parents before they get to that point. Where do you want to retire? What kind of insurance do you have? Were you able to take the insurance that you had when you were working? What do you foresee? How are they physically, mentally? And you want them to be in a state where they're able to get as many benefits as they possibly can to remain at home. We kind of look for, we need to go to someplace warm, and, we kind of look for, the nice sandy beach, but you want to make sure that the state that you're residing in is going to provide you care when you need it, because you don't want to exhaust all your funds and then you're left with nothing.
Yeah, no, we can't have that. This is a lot of great content. So first off, I just want to pause for a moment and thank you. This is a lot. So there's Medicare, Medicaid. We have to think about finances. We have to think about getting access to these finances. We have to think about the conditions that the comorbidities that they have, mental, all these things that are sort of thrown at us when we're at the center of caring for a loved one. What if we wanted help and we wanted to contract with someone like you to get this concierge and help us just navigate this crazy quagmire of healthcare? What would something like that cost? How should we think about it? What should we look for? Where do we start? Like, just help give us some guidance as what we should think about and how we should think about you.
Yeah, I mean, if you need help and you need guidance, and clearly you do need an expert to navigate this black hole, it could run you between $2,500 upwards to $10,000. It all depends on, what we are preserving, if there's a home involved, if there's retirement accounts involved. So everyone has their own specific financial footprint, and our fees are based on that financial footprint.
Got it. Okay. If there are any other questions, let's pop them in. But I do want to, obviously thank you for your time. But I want to turn it over to you for any closing comments, guidance. ConnectCareAG.org. That's where we can find you, and let them know that we're on this webinar, and you'll get a free consultation and spend some time with you, Gina Lisa. But I'll turn it over to you, and then we'll wrap this up.
Yeah, we're an agency, and it's a personal agency that was built on my daughter, who was born with Down syndrome, and I didn't know where to turn, and I knew that I had to open up an agency to guide people, because I knew there was things, there was grants, there was services out there. And please feel free to just call, even if it's a question. We are not that company that, we're going to charge you by the minute or the hour. If it's something really quick that we can answer, call. Whatever you feel that you are concerned about your elderly loved one, just call us. We are here for you guys. We do provide a service, but we are very informational as well. And we are here for you guys. And you can call us at our office, 646-745-9122, or you can visit us at our website, www.connectcareag.org.
Okay, that's great. And what states do you operate in?
We do tri-state. We're kind of shying away from New Jersey, but we do help New Jersey clients.
Okay. Excellent. We have some introductions to make. Some folks have asked for your information. I will distribute that to the group. And,
Thank you.
And so you should be receiving some phone calls. But again,
Right.
big hug. Thank you so much.
Thank you.
You've been wonderful. And thank you for your time.
All
Thank
right.
you all.
Thank you, guys. Take care.
All right.
Bye-bye.
Be well.
You as well.